Today I'm going to show you a case of a patient who had knock knee correction surgery. The patient was a man in his early 20s who came to us mainly because the shape of his legs caused him a lot of stress. He also mentioned having knee pain when running. So what exactly are knock knees? They look like this, where the knees are close together and the ankles are far apart. Because it resembles the letter X, it's commonly called X legs or knock knees. The medical term is genu valgum. Men in particular often find this condition uncomfortable, especially during exercise. When running or working out, the stride tends to narrow, and with knock knees, the knees may rub together or collide, making physical activity difficult or painful. So people with this condition often feel discomfort when running. The patient said he felt knee pain especially when running. This makes sense, since knock knees cause body weight to be distributed toward the outer part of the knees. The front of the knee, the patella joint, also gets strained. For people with knock knees, it also causes a bad environment for this joint. While we can't say with absolute certainty that the pain came from the knock knees alone, it's clear that the condition can create unfavorable biomechanics. When we looked at his x-rays, there were no major issues aside from the visible knock knees. Upon closer analysis, we found that in the right leg, both the femur and tibia were curved. In the left leg, the deformity was mainly in the femur. It was curved like this. Each case is unique, and we tailor our surgical plan to the individual's specific deformities. For this patient, we decided to perform corrections at these 3 points. Now, let's take a look at the post-surgery results. As you can see from the photos, the knock knees have been successfully corrected. The correction looks great. Looking at the x-rays, we performed corrections in both the femur and tibia on the right leg and in the femur only on the left. The overall alignment turned out very well. But here's something really important. Legs exist in 3 dimensions. You have to look at not only the front view, the x-axis, but also the side view, y-axis, and rotation, z-axis. This long bone is twisted like a spiral, so we also need to evaluate the rotational alignment as well. In surgery, all 3 axes, x, y, and z, must be considered. I've seen patients who had surgery elsewhere and came in later with complications because only one dimension was corrected. For instance, someone might get femur correction for knock knees but end up with an awkward side profile or excessive outward rotation because the surgeon didn't control the rotational axis properly. So again, during surgery, we have to manage all 3 planes and control it very well for a successful outcome. In this case, the x-axis, front view, was successfully corrected. The y-axis, side profile, was slightly bent pre-op, and we adjusted it accordingly. I always evaluate whether straightening the y-axis will benefit the patient and only proceed if it will help. For this patient, correcting that slight bend helped align the knees better. We also maintained proper rotation along the z-axis throughout the procedure. As for the scars, they're very small. Despite using relatively large internal fixation devices, the entry point is about 2.5 centimeters. So from an aesthetic perspective, the scars are minimal. Traditional surgeries usually involve larger incisions, like this much. So the difference is quite noticeable. But more important than just appearance is that with these small incisions, we avoid damaging internal soft tissue. The true meaning of minimally invasive surgery isn't just about small scars, it's about minimizing damage to internal structures like soft tissue and bone. This reduces the risk of complications and speeds up recovery. This patient's surgery was successfully done using a minimally invasive approach. To sum up the key points, even for the same knock knee condition, the location of the deformity can vary. It might be in the femur, the tibia, or both. Each patient requires a personalized analysis. And during surgery, we must consider the leg alignment in 3D and aim for the least invasive method possible to ensure a faster, safer recovery. That concludes today's case on knock knee correction. Thank you for watching.